Good morning, my name is Neeraj and my presentation today focuses on leadership and management in early childhood education, specifically exploring quality area 6, which is collaborative partnership with families and communities. Slide 2, Introduction and Rationale. I decided to work on the area of collaborative partnership with families and communities, or QA6, which the importance of collaboration is at the core of realizing high quality results in early childhood care and education. The rationale of this choice is the collaboration with families and communication with the communities with promote trust, inclusion and continuity between the home and learning settings essential to the holistic development of children. The topic is based on the National Quality Framework that focuses on respectful relationship, inclusive one and communicative relationships. The resources and theories I have been utilizing are Turk Culta 2023 and Mistral at 2023 and Leadership Studies by FU 2022 and Fonson in 2022 as the role of leadership in facilitating meaningful collaboration is vital. Slide 3, Family Engagement Part 1. The first part of QA6 is based on the family engagement, which is very important, and it focuses on helpful relationship and respect for parental opinion. A study conducted by Durley and Turk in 2023 points to the fact that genuine involvement is achieved then teacher shows active awareness of the experience, background and value of families. Michelle in 2023 also believes that family community collaboration with provider enhances the achievement of child's well-being and healthy equity. Such studies indicates that teachers need to embrace the idea of being culturally responsible and be willing to employ the use of flexible communication models that can help them overcome the various barriers like language availability and socio-economic barriers. Finally, family generated is not a communication issue but also a decision making and participation in the learning of children. Slide 4, Family Engagement Part 2. The role of leadership is important in improving the engagement of families. Archin, author, in 2019 have found that early childhood leaders are experiencing challenges in balancing the administrative requirement with the necessity of connecting with families in a meaningful way. According to Few 2022 and Fonson in 2022, the transformational and pedagogical leadership strategies enable teachers, including families, in the process of decision making. When the leadership focuses on collaboration and shared responsibility, family involvement is more fruitful, enhancing inclusion and promoting a sense of shared responsibility regarding learning in children. Slide 5, Community Partnerships. QA 6.2 is based on the concept of community partnerships which facilitate inclusion, continuity, and participation. Clark in 2023 underlined that joint efforts need to be based on trust, common goals, and clear communication to prevent tokenistic involvement. As Tamshin in 2025 observed, inter-stakeholder partnerships are an excellent source of asset and resources as well as support. However, they can be disrupted by issues like power imbalance and lack of accountability. Connecting families to community service, as Mistral in 2023 emphasized, also enhances the well-being and inclusion of the children. These results demonstrate that collaboration is situational, recreational, and crucial to the attainment of QA objectives. Slide 6, Leadership as a Catalyst. Part 1, Leadership is an agent of significant family and community associations. Alchin in 2019 emphasizes that a leader who can balance their managerial role with the participatory style can provide families with a sense of importance and belonging, which also directly contribute to NQS element 6.111 as demonstrated by Flew 2022 and Fonson in 2022. Pedagogical and transformational leadership can motivate educators to incorporate the cultural knowledge of families into planning of the program. according to the element 6.1.2 and element 6.1.3. This type of leadership is not only managerial, but it also develops trust, joint responsibility, and joint design programs. Slide 7. Leadership as a Catalyst Part 2. QA 6.2 standards are also observed that when the leader influences the quality and sustainability of the community engagement, according to the Mistral in 2023, the active participation of the leadership facilitating the co-designed initiative between families and community organizations will improve children's access, inclusion, and participation. Clark in 2023 also underlined that distributed leadership, effective communication, and vision, showing that sharing prevention the presence of tokenistic collaboration. This is because good leadership facilitates meaningful, equitable, and sustainable participation. Slide 8. Challenges and dynamics. The adoption of collaborative partnership is associated with a number of challenges. According to Turek in 2023, cultural diversity, language barriers, and different level of availability can be hindrance of meaningful family participation. Engagement may also be limited by leadership limitations, including conflicting managerial and pedagogical responsibilities. Alchin in 2019 underlined accountability, different stakeholders' priorities, and insufficient resources being a hindrance. Clark in 2023 and Teshim in 2025 also complicates the issue of community partnerships. Effective partnerships involve trust, proper governance, and careful planning in order to realize fair and viable partnerships. Slide 9. Critical synthesis gaps and recommendation. There is a high level of agreement in the literature that collaborative partnerships enhance the learning, inclusion, and well being of children. It is always focused on the importance of distributed and pedagogical leadership as a vital facilitator. Few in 2022 and 2022, for instance, there are still gaps such as insufficient studies of how to maintain partnership in the long run and under different community conditions. To mitigate these gaps, culturally responsible engagement, distributed leadership, community structures, continuous evaluation, and resources of sustainability can improve the suggestion. Slide 10, which is conclusion. Finally, it is important to highlight here that collaborative partnership with families and communities is inherent in advancing quality outcomes in early childhood education. As QA6 stipulates, the literature proves that meaningful engagement, culturally responsible practice, and co designed initiatives contribute to the inclusion, well being, and learning of the children. Leadership, especially distributed and pedagogical leadership, serves as a driver towards maintaining such as partnerships, and then long-term sustainability is facilitated by structures, proper resources, though the bridging of the existing gap and incorporation of continuous improvement strategies. Early childhood services can make sure that the collaboration practices are effective, equitable, and responsive to the various needs of children and families. So there are some references as well. I will provide those references in the next slide. The last slide, references. Few references I have taken, that is Evidencing Leadership and Management by author, Challenges in Early Childhood in Australia, 285 to 297, and Clark R. Gaber data in 2023, which is Understanding Collaborative Implementation Between Community and Academic Partnership is a Complex Intervention. And next is Darley in 2023, Educational Studies, a Phenomenological Studies, International Journal of Psychology and Educational Studies, which was in 2022. And then Fonson T. Kupalia in 2022, which is the Leadership of Early Childhood Education, Educational Research, the Teachers of Pedagogical Leadership in Early Childhood Education and Educational Research. Then crossed by in 2022, partnering with families communication to improve child health and health equality, which is in North America. And the last one is Harvard benefits challenge and best practice of collaborative partnership among health supply chain stakeholders in Nevada. A cross-sectional studies BMC Health Services Research 2015-75, and I have provided all the links in the slide. Thank you so much.